coming in by via stroke. Either they walk in or they come in by EMS. If they walked in, we're getting them triaged as quickly as possible. We're getting them to the CT room. That's the first thing you want to know. Try to get them into the CT room. Get the CT scan done and put in an IV. And then we're gonna wait to see if it's either a brain bleed or if it's a blockage. Now, if it's a brain bleed, we're not giving TPA, which is, or what I think it's called TNK now. TNK. Because TNK is IV push and it's faster instead of TPA, which takes a lot to prepare and all that. But TNK we would not give to a patient that has a brain bleed because they're already bleeding in the brain, and that's a blood thinner. Now, if they have a blockage in their brain, then we're going to be giving them TNK to, it's basically a clot buster. We're going to bust that clot, and they're going to be under surveillance every 5 minutes, every 15 minutes, every 30 minutes, and there's a protocol for that over the first 24 hours. So after we get the IV, we're checking to see if the CT scan is telling us if it's a brain bleed or if it's a blockage. Then we take the patient back to the emergency room. They have a room at this point. We're doing an NIHSS scale on the patient. We're checking eye movement to see if they can speak. We have a cold stroke cart in the room for the neurologist to do that assessment whilst we're in that room as the nurse, also assessing the patient and seeing how they are responding to the scoring on the NIHSS. We get in labs.